that you are allergic or immune to your own eggs, and the ability to implant is becoming a hotter and hotter topic.
That's interesting. Can you go into that a little bit?
Yeah, autoimmune. So the thought is, okay, if we have so much inflammation and it appears to be of an autoimmune nature, is this in fact the culprit? So if you've got eggs, you're 25 years of age or 30 years of age, you have follicles, you have eggs available, and you can get those eggs into the uterus, but something happens. You have what we call a medical pregnancy, where you start to release HCG, and it would, by all accounts, appear that you're pregnant, and yet you cannot implant that ovum. What's happening? The thought is either the uterus and the lining is inhospitable, or our own body is attacking that egg and destroying it before it has a chance, which is pretty scary. So what do you do about that? Well, if you approach this from an autoimmune/inflammation perspective, you've got to start by looking at self. What are the things that cause inflammation? You and I both know, we see folks every single day. Their brain's on fire. They've got poor gut health.
Because inflammation's systemic. So
Exactly.
You can see it in other areas.
Exactly. And it is foolish to think that if it's systemic in your head and your gut and your joints and everywhere else, but it's not in your uterus, that's kind of a fallacy, isn't it? So I tell gals, 4 to 6 months before you anticipate trying to get pregnant, you've got to look at your weight. Are you 20, 30, 40 pounds overweight? That's the first place you've got to start, because you and I both know if you're overweight, your insulin sensitivity is compromised, and that's the first degree of inflammation right there. So start with your weight and look at that through a very serious lens. And look, we're not shaming you.